So the next two that we're going to assess are going to involve the stomach channel and the spleen channel, and by association the CV. So the first is called hip extension. So you want to support the patient at the ankle, and then you want to bring the leg up and the knee up like this. All right, how's that?
Not bad.
All right. You don't really want to pass 45 degrees, or maybe 90 degrees, I guess, with the leg here like this. So you don't want to bring the knee back like this and then lift it up. You really want to keep a little bit of an angle, so when you're lifting like this, it doesn't put too much strain on the hip. Okay. Any pain or discomfort there?
Not much.
Okay. And then one of the things that I like to do is, on the second go round, is provide minimal lift and actually ask the patient to bring their knee up off the table. So go ahead and bring your knee up off the table. So I'm just really guiding. He's holding his own weight. And bring that up as much as you can. How's that? Is that all right? Mm-hmm. Okay. And then I like to help the patient bring the leg down so it doesn't just drop to the table. So the next one is called knee flexion, and that's very simple. Just bringing the knee up as close and as far as you can go. How's that? Okay? Mm-hmm. All right. And then the second time, I like to actually have the patient do it themselves and just guide. So bring the knee up as far back as you can. And then back down. Okay. And again, that's going to assess the spleen and the stomach, and by association, the conception vessels. So these next two are going to assess the bladder channel and the kidney primary channel, and by association, the governing vessel. So the first one is simple flexion, hip flexion. So we're going to bring the patient's leg up as far as is comfortable. About there is good? Okay. And then the second time, I actually want to have him do most of the lifting himself with his own power, and I just guide, just to the point of discomfort, if there's any. All right, we'll bring that leg down. So, one word of caution: if your patient is dealing with a suspected bulging disc or a low back injury that might be involving the nerve root, you want to be very careful when you do this test. And so as you're bringing it up, like let's say Pete came in, he said, I strained my back. I haven't been to the doctor yet, but it's in a lot of pain, and I get radiating pain down the leg. That's going to be your key red flag when you're doing this test. Because as you'll find out in another part of the course, in another video, there's something called the straight leg raise, which is basically this very movement. So if somebody has a bulging disc, or even worse, a ruptured disc, they're going to start to feel pain somewhere around the 30 to 35 degree range. So you want to always do this very slowly, and you want to make sure you're looking at the patient's face in case they're showing signs of distress or discomfort. So in case of a low back injury or a strain or a sprain, even if it's something minor, like, I was lifting something out of the trunk of my car and I felt this twinge, you want to be very careful doing this test. And by careful, I mean just moving slowly and paying very close attention, right? So if somebody has a ruptured disc, they're going to start to feel it about here. If somebody has a bulging disc that's not too severe, they'll probably be able to make it up to about here. And then again, if it's just a strain or a muscle ache, right? Nothing too severe, maybe even a sprain, a slight sprain, they can probably come up to about 70 degrees. All right. The second one is going to be hip and knee flexion together. So you're going to support the leg. I like to kind of come under the ankle and under the knee, and basically just bringing the leg up like this. Any discomfort? Okay. Now in this test, you can also hook their foot inside of your arm here, and that gives you a little bit of extra push, because you don't want to be pushing with your muscles. Really letting your body weight do the work as you lean, right? Okay. No discomfort there?
Just tightness in the hip flexor.
Just tightness in the hip flexor. That's not uncommon. Also with the leg flexion, a lot of folks, especially as we get older, the hamstrings are going to get a little more tight. So the discomfort that people may feel, you want to make sure you ask them where they feel it. So it's specific, because a lot of times if you lift this up, and they say, that really hurts, you may assume it's something going on in the low back, when actually it just may be a tight hamstring. So these next three movements are going to assess the gallbladder, liver, and by extension the dymi. So the first is called lateral rotation. So you simply assist the patient in bringing their heel or their inside of their foot to their knee. And if they have trouble doing that, you can bring it against the table, right? If they're more flexible, you can bring it up above the knee. But for some folks, especially older folks who haven't had a lot of exercise, they may not be very limber. And you can support their leg, and you have a hand under their knee, and you simply help them bring the knee out and down. Any discomfort there?
A little bit.
A little bit in the hip?
Yeah.
Okay. So again, as soon as the patient responds with an experience of stiffness or pain, that's when you want to stop. You don't need to go any further. And then I like to do it again a second time if I can. Bring the foot up just a little higher, bring that down, and again just supporting it. Right there? Okay. All right. And then bring the leg back into position. So the next one is adduction. And this can be done with the patient on their back, supine, or on their side. In the beginning, you just simply have them bring one leg over the other into adduction, adduction. Any discomfort there?
We stopped it 3 times. Yeah.
Okay. All right. And then going the other direction.
We're right about.
Right about there? Okay. And where did you feel that?
IT band and hip.
Right along the IT band and hip, right? Right along the gallbladder meridian. Okay. So the next one is going to be the counterbalance to the adduction, which is abduction or abduction. So you start with the patient's feet fairly close together. And then you support them bringing their leg out. Any discomfort there? Actually, you're very flexible, so that's good. All right. And then I like to have them do this again, mostly under their own power. So I'll guide, but you lift and stretch it out. Any discomfort? Now you can see there's, right about there?
Yeah.
Okay, so we'll bring it back. And you can see there's a natural tendency sometimes as they get close to the end range for the knee to start to bend, because that's going to slacken the muscles in the quadriceps, and that will actually give them a little more stretch, right? Because if you bend the leg like this, you can see how much further you can bring the leg out. So people might cheat a little bit. All right.